What percentage of U.S. adults have uncontrolled blood pressure? Is Tenecteplase effective after 4.5 hours in patients with an acute ischemic stroke? What is opportunistic salpingectomy, and can it prevent ovarian cancer? This and much more on today's JAMA Editor Summary. Hello, and welcome to our listeners all around the world. Today is Friday, February 6th, 2026. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today, I'm joined by JAMA Deputy Editor Dr. Preeti Malani. Hi, Preeti. Let's get started.
Hi, Linda. Dr. Ma and colleagues report results from the Option trial, a randomized open-label clinical trial among patients with acute, non-large vessel occlusion stroke and salvageable brain tissue. This trial, which included 570 patients from 48 centers in China, assessed functional outcomes and safety of intravenous Tenecteplase administered 4.5 to 24 hours after symptom onset. Participants were randomly assigned to intravenous Tenecteplase or standard medical treatment, which included antiplatelet therapy. The primary efficacy outcome was an excellent functional outcome at 90 days, defined by a modified Rankin scale score of 0 or 1. Additional safety outcomes included symptomatic intracranial hemorrhage within 36 hours and mortality within 90 days. More participants in the Tenecteplase group had an excellent functional outcome at 90 days, which was achieved in 43.6% of patients getting Tenecteplase, compared with 34.2% in the control group. Mortality rates were similar between groups. However, symptomatic intracranial hemorrhage was higher with Tenecteplase. This was 2.8% compared with 0%.
Thanks, Preeti. Clinicians can incorporate this new evidence into counseling for acute stroke treatment. Our listeners know that uncontrolled hypertension is a significant health risk. This topic is addressed in a research letter JAMA published this week. Dr. Hardy and colleagues conducted a cross-sectional analysis of blood pressure control among U.S. adults using the 2021 to 2023 National Health and Nutrition Examination Survey, or NHANES, data. The threshold for blood pressure control was a systolic blood pressure less than 130 millimeters of mercury and a diastolic blood pressure less than 80 millimeters of mercury. This threshold was based on the 2025 American Heart Association American College of Cardiology guideline threshold. Among more than 3,000 participants aged 20 or older, an estimated 79% of U.S. adults with hypertension had uncontrolled blood pressure, with about 39% reporting use of antihypertensive medication. Most treated individuals had blood pressure levels of at least 10 millimeters of mercury above goal, indicating a need for intensified treatment. However, 61% were not taking any antihypertensive medication. Adults not taking medication were generally younger, had lower cardiovascular risk, and had blood pressure levels closer to the guideline goal. In addition, those not taking medication were less likely to have health insurance and a routine place for health care. Earlier initiation of antihypertensive medication and more intensive pharmacologic management may reduce cardiovascular risk.
Blood pressure is certainly important for patients and clinicians to monitor. Linda, there's also a research letter by Dr. Lim and colleagues comparing trends and disparities among heat-related and non-heat-related U.S. Emergency Medical Services, or EMS, activations, using 2019 to 2024 data from the National Emergency Medical Services Information System and population-adjusted rates by sociodemographic and geographic characteristics. The authors reported that although both heat-related and non-heat-related EMS activations increased nationwide during this period, heat-related EMS activations rose slightly more slowly than non-heat-related activations overall. However, the investigators identified specific vulnerabilities that may be related to occupational exposures and limited access to cooling associated with health-related EMS activations rising faster than non-heat-related activations. These differences were noted among middle-aged adults, lower income regions, and certain Western census divisions. The authors suggest that targeted public health interventions and system-level planning are needed to address rising EMS demand and heat-specific health risks among vulnerable populations.
In their viewpoint, Drs. Pleasant and Ring discuss how the FDA removal of black box warnings for menopausal hormone therapy prompts reconsideration for survivors of breast cancer. They emphasize the importance of individualized assessment and careful, informed, shared decision-making.
In another viewpoint, all 9 living former members of the Women's Health Initiative Data Safety and Monitoring Board discussed concerns about the process used by the FDA to remove most box warnings from the package inserts of approved estrogen and other hormone replacement products. The authors urged the FDA to convene an advisory panel to weigh the evidence for benefit and risks of various menopausal hormone products. Dr. Stern and colleagues contributed a thoughtful perspective article that provides rationale for shifts in accreditation for medical schools and training programs that would move to rigorous, outcome-based evaluation designed and led by medical education experts. Such reform would improve quality assurance, align training with societal expectations, and promote meaningful external validation.
Opportunistic salpingectomy, or removal of fallopian tubes during unrelated pelvic or abdominal surgery, can reduce tubo-ovarian cancer deaths without adversely affecting short-term ovarian function. In a special communication by Dr. Peek and colleagues, the European Society of Gynecologic Oncology shares their consensus statements that provide expert assessment of the evidence for opportunistic salpingectomy. The authors encouraged clinicians to offer this effective prevention method to eligible women. The related JAMA Clinical Reviews podcast brings clinicians up to date on the evolving science around the etiology of ovarian cancer and the potential role of opportunistic salpingectomy. Let's listen to a bit of my conversation with Dr. Peek.
So if there is an option to prevent this disease, then I think we are obliged to discuss that with our patients. I think we all had this oath we had to give once we became doctor, and that's part of our oath. We also need to be able to prevent certain diseases. So if we now know how to prevent this terrible disease, then we also need to discuss that with our patients.
Prevention of ovarian cancer without removing the ovaries. Well, this is really an important clinical insight, Linda. Dr. Worthington and colleagues discuss premenstrual disorders, including premenstrual syndrome, PMS, and premenstrual dysphoric disorder, PMDD, in their clinical guideline synopsis. The authors note that treatment selection should be individualized based on symptom profile, patient goals, and contraception needs.
And the JAMA patient page this week focuses on the misuse of nitrous oxide, commonly known as laughing gas. The patient page describes how nitrous oxide is misused and the potential health risks and complications and ways to prevent misuse.
The JAMA Medical News Summary podcast that publishes every Friday has the latest medical news. You can subscribe at jamamedicalnews.com or click on the link in this episode's show notes.
Thanks, Preeti, and thanks to our listeners for tuning in to hear what's new at JAMA. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thank you for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.